Hi, everyone, and welcome to Ask the Blood Detective. My name is Dr. Michael Wald, and I'm a holistic healthcare provider that practices in Chappaqua, which is located in Westchester County, about an hour north of New York City. I've been practicing holistic, or you might say integrated or complementary natural healthcare for over 30 years. I work with any number of health problems because, in my opinion, many health problems today, whether it's heart disease, cancer, sleep issues, which is the topic of today's talk, or autoimmune diseases, you name it, there's some nutritional component. Either nutritional issues cause a lot of these chronic and some acute health problems, or at the very minimum, or at the very least, health problems result in nutritional issues. So whether your health condition is potentially caused by nutrition or results in nutritional problems, my series of podcasts is for you. If you want to reach me, you can do that by emailing me at info@blooddetective.com, or you can call at 914-552-1442, and my website address is www.dr, that's drmichaelwald.com. That's drmichaelwald.com. So today's topic, as I just mentioned, is all about sleep, and it will include a discussion of sleep apnea. And I've titled today's talk, Sleeping Smarter Naturally. So let's begin by just giving a short definition of sleep, because we all assume we're on the same page about what we even mean by that. So I guess one way of explaining it is that sleep is it's a naturally occurring state of mind and body, and it's characterized by altered consciousness, reduced sensory activity, and inhibition of voluntary muscles, right? You're just out cold. And that's where your unconscious is working, because you are literally unconscious when you sleep. And your dreams and thoughts and all of that, those images that come up and ideas, that's all from your unconscious. Just a simple side note, or interesting, I should say, side note. And sleep is essential for overall health and well-being. It plays a crucial role in a variety of physiological processes in the body, like cognitive function, emotional state or regulation, immune function, and all aspects of physical health. And it's really important to keep in mind that without proper sleep, healing is impaired. You must have sleep so that your healing is happening. And our nervous systems function within what's known as a sleep-wake cycle, which is regulated by something called a circadian rhythm, which is influenced by all sorts of external factors like light and temperature. The stages of sleep are categorized into non-rapid eye movement, which is NREM, or REM sleep, as most of you have heard of, and rapid eye movement sleep. So again, we have non-rapid eye movement and rapid eye movement. The rapid eye movement is REM, and the non-rapid eye movement is NREM, okay? And each of these two different forms of sleep have distinct characteristics and function. So let's talk about what sleep actually does in some detail in the body. So again, sleep serves vital functions that are absolutely essential for human health and well-being. And some of these functions include at least 5 main areas that I can think of that I think are important for everyone to know. One I'll call restoration, because sleep allows the body to repair tissues, consolidate memories, and release hormones that regulate growth and appetite. And then there's the cognitive function of sleep. So adequate sleep is absolutely crucial for optimal cognitive function, including attention, memory, accommodation or consolidation, problem solving, and decision making. So without proper sleep, you're not going to make decisions properly. You're not going to be able to solve problems as well or as clearly. Your memories might feel a bit disjointed as you recall memories. So there's all sorts of areas that must be managed with proper sleep. And if they're not, we run into lots of trouble. For example, emotional regulation is another one. So I started out with restoration, which is repair of tissues. And then cognitive function, how sleep affects the brain. And then there's emotional regulation, because sleep plays a significant role in emotional processing and regulation. It influences mood, the stability of your mood, and also your resilience to stress. So, sleep can reduce your resiliency to stress, which can make you more susceptible to infections and degenerative diseases. And this brings us to the other category that helps define how sleep allows us to function properly is its effect upon the immune system, because quality sleep is essential for a well-functioning immune system. Many studies have shown that improper sleep can result in increased risk of infection due to a lower production of white blood cells or a normal production of white blood cells, but they simply don't work very well. And the sort of fifth general category is sleep's effect upon one's physical health. Chronic sleep deprivation has been linked to an increased risk of all kinds of health conditions, including obesity, diabetes, cardiovascular disease, and even decreased lifespan. So we've got these 5 functions of sleep: restoration, cognitive function, emotional regulation, immune function, and physical health. So let me just step back a little bit and just give you a minute or two more information on those stages of sleep that I mentioned above: the non-rapid eye movement, the NREM, and the rapid eye movement, or the REM sleep. So I'll start off with REM sleep because most people have heard that. And again, this is going to be brief. So REM sleep is characterized by rapid eye movements. Therefore, that's why it's called REM sleep. And also vivid dreaming and muscle paralysis, so very little movement of muscle. And it's associated with memory consolidation, so memory integrity, you might say, emotional processing, and learning. And the non-rapid eye movement, when we don't see rapid eye movement when someone's sleeping, this stage is divided into 3 substages. And I'll briefly mention them: N1, N2, and N3. I'll let you look at the notes, which you can find on my website at drmichaelwald.com. Just search the search bar for the title of this presentation, which is Sleeping Smarter Naturally, and you can read more about the non-rapid eye movement and the rapid eye movement sleep. So let me now move to sleep disorders, the more common sleep disorders that I have seen in my 30 plus years of practice. And there are other sleep orders, but I'm going to give you sleep disorders, but I'm going to give you about 5 of them that are particularly common. So again, there are several sleep disorders that can disrupt the normal sleep patterns and impact overall well-being. And these disorders include insomnia, sleep apnea, restless leg syndrome, really a problematic condition, narcolepsy, and parasomnias. So let me go back to insomnia. So insomnia is characterized by difficulty falling asleep or staying asleep. And that can lead to inadequate rest, obviously, and impaired daytime functioning. Lots of people suffer from insomnia. And then there's sleep apnea, and that's a condition marked by pauses in breathing during sleep, and that'll lead to fragmented sleep and decreased oxygen levels in the body. And sleep apnea, as well as many of these conditions I'm mentioning now that are related to sleep or are sleep disorders, tend to result in a shorter lifespan and an increased number of comorbid conditions as one ages. So again, sleep is as fundamental as food and water. And then there's restless leg syndrome. This can keep a person awake. So individuals with restless leg experience uncomfortable sensations in their legs during periods of inactivity or rest. So they might be just trying to go to sleep and they feel these it's very hard to describe. Some describe it as a pins and needles sort of feeling, and the legs sort of kind of move on their own. They just can't, the person just doesn't feel that their legs are comfortable, so they're moving with this very, again, uncomfortable feeling. Now, there are many different causes of restless leg syndrome. And most doctors won't tell you this because they just don't know. A person will say, well, when I try to sleep, I get these odd sensations in my legs and it keeps me awake. And they say, well, you have restless leg syndrome, which you might. And restless leg syndrome can be caused by cardiovascular disease, problems with the circulation of blood in a person's legs. Another very common cause is magnesium deficiency. A third one is iron anemia. And a fourth one are heavy metals. Now, I can go on, but these conditions, restless leg and sleep apnea, insomnia, have many different causes. And the medical and the nutritional and natural solutions for these conditions have to be based on not just what diagnosis of sleep disorder someone has been given, but what their chemistry actually says they need. So again, 10 people with restless leg syndrome literally might all have different causes of their restless leg, and that has to be addressed. And another sleep disorder is called narcolepsy. That's a neurological disorder that causes excessive daytime sleepiness and sudden onset of REM sleep. So people they're just gone. They fall asleep and they're in REM sleep. They could be driving at the time. And then there are these parasomnias or parasomnias. And these are abnormal behaviors or experiences during sleep, such as sleepwalking and night terrors. So you should realize now that sleep is essential for overall health and well-being, but various health problems do and often cause significant impacts upon the quality and duration of sleep. Now let's move into the top 10 ways in which sleep can be affected. Because again, if you were to come to me and say that you wanted help with your sleep, I would have to go through a detailed conversation with you and detailed questionnaires and detailed examination and usually some testing to figure out how to manage that. So chronic pain is a very common cause of sleep issues. The pain can come from, let's say, arthritis or fibromyalgia, could be cancer pain, back pain, neck pain. All sources of pain in the body make it difficult to find comfortable sleeping positions, leading to frequent awakenings during the night and overall disrupted sleep patterns. But also chronic pains associated with inflammation, which activates the wake areas in the brain, to put it simply. And then there's mental health disorders, so conditions like anxiety, depression, post-traumatic stress disorder or PTSD, and bipolar disorder can cause disturbances in sleep patterns. And then there are respiratory disorders, conditions such as asthma, chronic obstructive pulmonary disease or COPD, and sleep apnea all can lead to breathing difficulties during sleep, resulting in frequent awakenings and poor sleep quality. And then there are a whole bunch of neurologic disorders. Let me just summarize for a second what we're talking about here. We're talking about various health conditions that affect sleep quality. So I began by describing chronic pain, how that increases wakefulness, mental health disorders, respiratory disorders, and then there are neurologic disorders, which I'm about to describe now. So conditions such as Alzheimer's disease, Parkinson's disease, epilepsy, multiple sclerosis, all can disrupt sleep-wake cycles, leading to insomnia, excessive daytime sleepiness, and all kinds of other health problems. Even gastrointestinal disorders can cause sleep problems. So, for example, gastroesophageal reflux or heartburn, which has nothing to do with the heart, by the way. Gastroesophageal disease results when stomach acid makes its way up into the esophagus because the valve between the lower end of the esophagus and upper part of the stomach is open or mostly open, and that allows the acid to come up. And stomach acid in the esophagus degenerates the esophagus and could cause even ulcerations and literal holes in the esophagus because, again, the esophageal tissues are not made anatomically to withstand stomach acid. And unfortunately, when you visit an internist or a gastroenterologist for help with esophagitis, they'll give you an antacid, which makes sense because it'll shut off the stomach acid, which, by the way, will cause malnutrition and malabsorption because we need stomach acid to absorb. So it's a tricky little slippery slope here. The treatments used in medicine, again, the antacids, and there's different types, there's H2 blockers, there's PPI medications, proton pump inhibitor medications, and there's others. None of them affect the valve. Gastroenterologists pay no attention to it. They never even test it. So it's an assumption that if you have esophageal reflux disease, you have an open valve. So the treatment would have to at least involve working on the nervous system, which controls the tone of the gastroesophageal valve, which is not closing all the way or at all, causing the stomach acid to come up. I thought it was a good idea to give you a little bit more background on gastroesophageal disease because gastroenterologists and internists never tell people these things. I've never heard them understand this when a client sits in front of me. I've seen multiple gastroenterologists. And if you don't know this, then you can't treat it right. And then there are various cardiovascular conditions that affect sleep quality. Heart conditions such as heart failure, coronary artery disease, can lead to symptoms like chest pain, shortness of breath, leg swelling that might interfere with sleep. Also, with a weakened heart or cardiovascular system, the blood flow to the brain and other areas of the body may be impaired, also resulting in insomnia. And another category of health problems that can cause insomnia are hormonal conditions, also known as endocrine disorders. So there are all sorts of hormonal imbalances associated with conditions like diabetes, thyroid disease, or menopause, which can contribute to sleep disturbances, again, such as insomnia or frequent nightmares. And then there's neuropsychiatric disorders, so conditions like attention deficit disorders, autism spectrum, may be associated with difficulties in regulating sleep patterns and maintaining consistent sleep schedules. And there's two other categories you should know about briefly that can lend themselves to insomnia or sleep issues, like musculoskeletal disorders. Arthritis, osteoporosis, musculoskeletal injury can all cause discomfort and pain that can disrupt sleep quality and duration. And then there's allergies and respiratory infections. So allergies and respiratory infections, like a cold or sinusitis, can lead to nasal congestion, coughing, sneezing, and obviously can interfere with breathing and disrupt sleep. So we just reviewed that there are 10, here's my top 10 picks, I should say, for sleep conditions that can disrupt sleep. Once again, chronic pain, mental health disorders, respiratory disorders, neurologic disorders, gastrointestinal disorders, cardiovascular, hormonal, neuropsychiatric, and allergies and respiratory infections. So no talk about sleep could be complete without at least some mention of sleep apnea. This is a big one because a good number of people in the United States suffer from sleep apnea, and it does, in fact, reduce not only quality of life, but length of life in many cases, in almost every case. It's the equivalent, or might even be worse in some ways, than smoking. So what is sleep apnea? Sleep apnea is a common and potentially serious sleep disorder that's characterized by pauses in breathing or shallow breaths during sleep. And these pauses can last for a few seconds to minutes or may occur multiple times per hour. And there are three major types of sleep apnea. There's obstructive sleep apnea, or OSA. There's central sleep apnea, and complex sleep syndrome, with OSA being the most prevalent form, which again stands for obstructive sleep apnea. So for example, someone's neck muscles and neck tissues might be so thick that they are putting pressure upon the respiratory system, causing sleep apnea. A person might have a neurological condition which is affecting the tissues in the neck area as well, which can cause sleep apnea. Some people seemingly have normal looking and appearing anatomy of the neck, but still have sleep apnea. And again, that could be from some hidden condition, any one of those top 10 or so conditions I just mentioned. And once again, as a reminder to everyone, you can download or read the notes for this and every other podcast of Ask the Blood Detector that I do by going to drmichaelwald.com, looking them up, and that's in the section going to the from the top menu, you just click the services section, and you might see the treatments that I have for different sleep conditions. And then there is a search bar where you just put in sleep apnea, and the text should pop up, and also the audio of this particular podcast. So what are the effects of sleep apnea on morbidity and mortality? Morbidity is quality of life, and mortality is death. So sleep apnea has been associated with various negative health outcomes, including increased morbidity and mortality. The condition can lead to a range of health problems, such as hypertension, cardiovascular disease, stroke, diabetes, depression, and cognitive impairment, and there are others. What I'm telling you is that these conditions and others usually are caused and or are contributing to or result from sleep apnea. And then there are the repeated episodes of reduced oxygen caused by these conditions during sleep, which strain the cardiovascular system. So sleep apnea strains the cardiovascular system and can contribute to the development of all those conditions I just mentioned. And additionally, untreated sleep apnea has been linked to an increased risk of accidents due to daytime drowsiness and impaired cognitive function or cognitive recall and reasoning. Now, in terms of mortality and death rate, a large amount of research has shown that individuals with untreated severe sleep apnea have a higher risk of premature death compared to those without the condition. The increased risk of cardiovascular events such as heart attacks and strokes obviously contribute to the higher mortality rates associated with untreated sleep apnea. Some people just don't want to admit that they have a problem. By the time they see me, it's been there for years. It doesn't mean it can't be helped, but obviously the sooner you begin working on these things, the better. So how does sleep apnea affect men and women? So how would I put this? Okay, so while sleep apnea can affect individuals of any gender, there are some differences in how sleep apnea manifests in both men and women. So men, for example, are more likely to be diagnosed with sleep apnea than women, but this may be due to underdiagnosis in women rather than lower prevalence. We just don't know. I would say, in my experience, for what that's worth, I'd say sleep apnea is around 50-50 in men and women. So women with sleep apnea may be more likely to experience symptoms such as insomnia, morning headaches, and mood disturbances rather than the more commonly recognized symptoms like loud snoring and witnessed breathing pauses seen in men. So that's really key. I'm going to repeat it. Women with sleep apnea as compared to men women are more likely to experience insomnia, morning headaches, and mood disturbances rather than the more commonly recognized symptoms of sleep apnea like snoring and the breathing pauses. Really, really key. Furthermore, the impact of sleep apnea on cardiovascular disease also may differ between men and women. So some studies, for example, suggest that women with sleep apnea have a higher risk of developing cardiovascular problems compared to men with the condition. Okay, so now you should be asking yourself, okay, so what are the most common causes of sleep apnea? Well, one would be obesity, because excessive weight, particularly around the neck, as I mentioned, can contribute to the narrowing of the airway, increasing the risk of obstructive sleep apnea. And then there are anatomical factors, which I just mentioned, one, the obesity, but certain anatomical features such as someone born with a narrow airway or enlarged tonsils or adenoids or a recessed chin may predispose individuals to developing sleep apnea. And then there's age. Sleep apnea becomes more common in people as people age, and people because the muscle tone and fat distribution in the body and in the neck area change, and they more favorably can promote sleep apnea. And then there is evidence suggesting that a genetic component might exist with sleep apnea. So having family members with the condition may increase your risk of developing sleep apnea. And then there's alcohol and smoking. So both smoking and excessive alcohol consumption can contribute to the relaxation of the throat muscles, leading to an increased likelihood of airway obstruction during sleep. So the takeaway here is sleep apnea is a significant health concern that may have far-reaching effects on morbidity and mortality. It impacts both men and women, although differences in the presentation of symptoms and associated risks are somewhat different between men and women at times. So understanding the causes and effects of sleep apnea is, in my view, absolutely crucial for early detection and effective management of the condition. Okay, before I move on to daily activities, what I call sleep hygiene practices for improvement of sleep and sleep apnea, I just want to give a quick disclaimer. Basically, that the information that I'm discussing today is for your educational purposes only. It's not meant to substitute for sound medical health advice. Nutrition and natural ways of dealing with sleep apnea are not the first line of therapy, as they say in medicine, although I think in many cases they should be. And the use or misuse of any of the materials that I discuss either here or on my website and other materials is at the risk of the user, which is you guys. So be careful. Okay, and again, and a reminder, you can go to my website at drmichaelwald.com, drmichaelwald.com, for all of these notes. Email me your questions, concerns, and show topic ideas at info@blooddetective.com. And you can reach me by phone at 914-552-1442. So what I'd like to do now is discuss some very potentially useful ways in which to improve sleep and sleep apnea, and I call them sleep hygiene practices. So the first thing is maintaining a consistent sleep schedule. And I'm going to say at the onset here that I go over these and other potential sleep hygiene practices with people, and very few people actually follow the advice. So, for example, if you do not have a consistent sleep schedule, anything else you try to do to help your sleep, short of medication, may not work. So, you need to establish a neurological pattern. That's what a consistent sleep schedule does. So going to bed and waking up at the same time every day, if you can, even on weekends, helps regulate your body's internal clock and improves the quality of your sleep. This consistency of sleep will reinforce your body's natural sleep-wake rhythms. The other important point would be creating a relaxing bedtime routine. So engaging in calming activities before bedtime, such as reading, not a murder mystery novel, by the way, or something stressful, but something relaxing. Taking a warm bath, listening to music. I like the idea of listening to music with no words. I personally relax by listening to a rainstorm and thunderstorm sounds. You know, when you activate if there are words in the sounds or in music that you listen to, that's more activating of the brain. So I like things that don't have words. Okay. So in addition, in terms of a relaxing bedtime routine, would be engaging in these calming activities. I mentioned a warm bath. I mentioned reading. Also possibly doing some deep breathing techniques or meditation. All of these can signal your body that it's time to wind down and prepare for sleep. There's, of course, more I can say, and I'm very precise with what I recommend to individual clients because everyone is different. So perhaps a different combination of these sleep hygiene practices may work better for one person than another. But I thought I would let you know at least the top 7 or so that I commonly use and discuss with clients, like, again, consistent sleep schedule, a relaxing bedtime routine. I wouldn't have you, let's say, drink some calming sleeping tea at night if you have a propensity for the tea to wake you up, for you to go and urinate. That would be contradictory. And then there's optimizing your sleep environment, ensuring that your bedroom is conducive to sleep by keeping it dark, quiet, and cool, but not cold. So consider using blackout curtains, earplugs, or white noise machines if necessary. And you can also invest in a comfortable mattress, that would be nice, and pillows that support good sleep posture. Then there is limiting exposure to screens before bed. So the blue light emitted by electronic devices like smartphones, tablets, and computers are known to interfere with sleep quality, and also to cause melatonin, which is a hormone required for sleep, levels to go down, and we don't want that. It's advisable to avoid screens at least an hour before bedtime. And if you do use, let's say, a melatonin to help you, and most clients that I've talked to over the years, they say to me immediately when I mention, oh, that never helps. First of all, you might be taking the wrong dose. You might be using the right dose, but the combination of your other sleep practices just is too overwhelming for your supplementary melatonin to work. But if melatonin seems to work with you, or maybe doesn't work consistently, is I would suggest you have a liquid melatonin next to your bed, because if you wake up in the middle of the night, that means your melatonin is low. So you want to supplement it right away, right then. If you put a pill or a capsule in your mouth and you have to drink water, that's a bunch of activity which could promote wakefulness, which is the opposite of what we want. The liquid, you just put it in and go back to sleep. That little thing can make a huge difference. And then you want to watch your diet and exercise. So Avoiding heavy meals, caffeine certainly, and alcohol close to bedtime, even wine, it helps you go to sleep, but then it improves, it causes more wakefulness. So that's not a long-term solution. So again, heavy meals, caffeine, alcohol, close to bedtime, they're all going to disrupt sleep, and most people. And then regular physical activity during the day can promote better sleep. It's probably best for people to avoid vigorous exercise right before bed, but I find that I can exercise rigorously before bed, and my exercise routines are very vigorous. So that actually helps me. And that's what's important here. We need to find out what works for each individual, and that takes a dedicated health professional and a person who's committed to making this happen, working within a structured plan of action to go through all of these sorts of ideas and concepts and develop a plan of sleep improvements that work for that person, which may change over time. Something may help, I might make certain recommendations, let's say, to you that will help you initially for months get better sleep. But then your body's health changes, something happens, maybe you have more stress, and you need to adjust what you're doing in certain areas. And being mindful of that will add up over time to the body, the nervous system, the sleep-wake centers in the body to become more automatic and put them more on a regular schedule. And then, of course, I don't need to tell you this, but I'm going to anyway, is managing your stress. Stress and anxiety can significantly impact the quality of our sleep. And engaging in stress-reducing activities, such as yoga, unless you hate yoga, then it's not a stress-reducing activity, or mindfulness, a meditation, or progressive muscle relaxation, that can help calm your mind before bedtime. So again, with myself, mindfulness meditation is very useful for me. I really focus on that a few hours before bed. And progressive muscle relaxation is really commonly ignored as well, where you're in your bed. You can look this up on the internet, progressive muscle relaxation, where you tighten up all your muscles for a bit and then you relax them. And that releases a lot of natural calmatives, endorphins, enkephalins, and serotonins through progressive muscle relaxation. I've gotten my sleep perfectly regulated to the point where now all I need to do is once I'm in bed and I put on my thunderstorm, rainstorm sounds, I literally pretend that I am the thunderstorm or the rain. It's hard to describe how I do that, but that's what I do. And I also say to myself, okay, enjoy these sounds, and before you know it, you'll be asleep, and then the next morning happens. So it's worked great. Once I've gone through a lot of training because I had insomnia for a number of years, long days at work, all kinds of stressors, and but now I've got it all worked out, and you can too. And then you want to seek treatment for your sleep disorder. So if you suspect that you have a sleep disorder, such as sleep apnea, it's crucial to seek professional evaluation and treatment. So effective management of sleep apnea often involves a combination of lifestyle changes and some medical interventions. But not to worry, because we're going to talk about nutritional interventions and even some nutritional tests and things that you can do to really, really get to the bottom of what is going on with you. But first, let me review some of the medical approaches, including medications for sleep and sleep apnea. And the ones I'm going to go over right now, mostly for sleep apnea. And I'm going to give you just a little bit of detail on these, and the rest, more detail, you can read by going to the website, and the notes will be posted. So, in addition to implementing sleep hygiene practices, medical approaches, including medications, are often used in the management of sleep apnea in medical circles. It's important to note that the treatment for sleep apnea should be individualized based on the severity of the condition and all sorts of other health factors, nutritional factors, stress factors, lifestyle factors. But here's a couple of the medical approaches and medications commonly used in the management of sleep apnea. There's the CPAP, which most people have heard of, which is CPAP. That's continuous positive airway pressure. And CPAP therapy is a common treatment for obstructive sleep apnea. It involves wearing a mask connected to a machine that delivers continuous flow of air in the airway, preventing it from collapsing during sleep. And I must tell you, it does work for many people, but others, it just backfires. So sleeping with a mask on your face is not easy. I really could never, I don't think I could do it. So thankfully, I was able to manage my sleep issues in other ways. But you need to know that there is something called a CPAP machine. And then there's a bi-level positive airway pressure, or BiPAP. And basically BiPAPs, as the term bi, which means two, tells you that these machines provide two levels of air pressure, a higher level when inhaling and a lower level when exhaling. And that can be beneficial to individuals who have difficulty tolerating a CPAP machine. And then there's adaptive servoventilation, or ASV. So these are devices designed to treat central sleep apnea, as well as complex or mixed apneas. And then there's various oral appliances. I won't go through them here. You might speak with your dentist about those. And then, of course, there's some surgical interventions, which might include a procedure known as UPPP, which is short for uvulopapillopharyngeoplasty. Okay, there's also tonsillectomy, adenoidectomy, and a few other different surgeries. And then there are medications. So while medications are not typically the first-line treatment for sleep apnea, they might be used in certain situations to address specific symptoms and underlying conditions. There are some stimulants, believe it or not. So in cases where excessive daytime sleepiness persists despite other treatments, stimulant medications may be prescribed to promote wakefulness during the day. And then there are hypnotics, and then there's weight management medications. There's all sorts of interesting approaches to sleep apnea in terms of medication choices. So what would happen in terms of choosing these and discussing them would be a conversation about sleep apnea where you work closely with your healthcare professionals to determine the most appropriate treatment plan based on your specific needs and your specific health history. So, okay, let's hit the nutritional. I would say I'm going to give you my top 10 picks for nutritional ways to help sleep. And realize that if some of them, if they don't work for you, that might be because, number one, you might be malabsorbing. Because, I've said this in my other podcasts of Ask the Blood Detective, that we are not what we eat. We are what we absorb from what we eat. And if you take the right, let's say, herbs to help you sleep, but you malabsorb 50% of them, they may not help you at all. And you'll say, well, this supplement didn't work. Or you might need a combination of different natural supplements at different ratios, taken at different times during the day, timed with or without your meals, or timed with or around your exercise plan. So you want to have the oversight of a qualified nutritional health practitioner. I would say that with chronic sleep problems, it is best to have, in my opinion, a healthcare provider who has a doctorate, like I do, in nutrition and other qualifications that allow the practitioner to do blood work and other tests. A dietitian, for example, cannot order tests. They cannot read these tests. And most dietitians don't know much about herbs, particularly if they've gotten traditional dietetic or dietitian education. So I am a dietitian. And in the state of New York, the other recognized nutritional credential is the certified nutrition specialist. They're very similar to dietitians in training, and I do have that. I also have a board certification in nutrition, which took a few extra years to get. So, and I can draw blood work and order and do exams and all of that. So when you can do those things, you simply can offer more to get to the bottom of things. Sometimes I'll just be frank with you. I'll have patients say, well, Dr. Wald, I'm going to try a dietitian because they're cheaper, and they'll do that and it doesn't work. Or it works for a short period of time. And they'll say, well, I don't know why it didn't work. I said, well, it wasn't based on your needs. What were your blood levels? What happened in terms of individual evaluation there? So just bear that in mind. Okay, so melatonin. I must start with that because everyone knows that that's supposed to be for sleep. Melatonin is a hormone. It regulates sleep-wake cycles. It helps improve sleep quality in many people, even with sleep apnea. And the dosages of melatonin may range anywhere from about 1 to 5 milligrams, about 30 minutes or so before bed. But I might use much higher amounts, particularly, let's say, if I'm dealing with a woman who has breast cancer and sleep problems. We know that melatonin at the right dose is anti-cancer. It helps kill cancer cells. And so we need to give enough for that, which is usually between 10 and 15 milligrams. And usually that dose will put practically anyone to sleep. And it helps, as I mentioned, just kill cancer cells. And then there's valerian root. It's an herb that's been used for centuries to treat insomnia and anxiety. So even sleep apnea, dosages are usually between 400 and 800, 1 to 2 hours or so before bedtime. And again, I don't think that most people will respond to any of these uh, top 10 nutrients that I'm mentioning. Some people need combinations of them. Okay, keep that in mind. Also, you want to use pharmaceutical grade nutritional products. If you use products that you've just heard about from the company, how good they are, or someone else told you they're good, that's not good enough. Because you know what's going to happen? You're going to try these things and then it's going to stop working. And then you're going to wonder why. And people get despondent and depressed and anxious from that. So get some guidance. And then there's magnesium. That's a big one that people think about. Magnesium's a mineral. It plays a crucial role in muscle relaxation, and it's a calmative for the central nervous system. It can also reduce pain. Magnesium has antioxidant functions. It's involved in over 500 reactions in the body, so it can be very useful for health conditions that might be promoting insomnia. And the dose is usually between 250 to 500. I like to use a magnesium loading test to figure out specific doses for people, or I might do a red blood cell level, which tells me the individual's magnesium levels on average over the last 4 months. If you do a serum or plasma magnesium, that just tells you the magnesium levels in the body for the last 3 to 5 days. That's not very useful. Most people don't know that. I'll say it again. The levels of most vitamins and minerals in the blood only give you the levels of the nutritional intake from the diet or supplements over the last 3 to 5 days. If you really want to identify nutritional deficiencies, you need to do the proper tests. So if I want to know what the average magnesium, as I mentioned, is in a person in terms of the levels over the last 4 months or 120 days, I would do a red blood cell level. If I want even longer than that for magnesium, I would do a white blood cell level. If I want a short level of magnesium, that would be plasma or serum. And then there's omega-3 fatty acids. They're essential for brain health, and they have been shown to improve sleep quality. So again, the doses of all of these nutrients, including omega-3s, I base the dosages on my clinical experience over 30 years practicing doing this, certain laboratory tests or questionnaires, and very importantly, a body composition test. Simply put, a body composition test is a test that will tell me the percentage of muscle, water, and fat in an individual's body. The lean mass, I should say. The lean mass is muscle and organs mass. And based on that mass, a person should have a certain number of milligrams or grams of any of these natural things we're talking about very specifically. Think about it this way. If you were a weightlifter and you wanted to build muscle, you would need a certain amount of protein, usually 0.8 milligrams, per kilogram of body weight. And if you want to gain double the muscle you have, then you might want to take 2 or 2.5 grams of protein per kilogram of body weight. So body weight, questionnaires, experience, the scientific literature, all of that is what I use to figure out in testing what people need for their sleep issues. And then there's passion flower. And, commonly you can get like combination formulas of valerian root and passion flower and L-theanine, which I'll talk about in a minute. And that may work, but remember the dosing that you're given on the bottle, those are just made up by the manufacturer. Many times, the companies are not even scientifically adept enough to put the doses of the herb or nutrient or minerals or vitamins in their products that are consistent with what the medical and nutrition literature says we need for health improvements. And then I would start with that kind of dose in my mind and then personalize it for the client based on, again, labs and other health problems and body composition and all of that. So, and the passion flower, I'm not sure I mentioned that the dose is usually between 450 and 900 milligrams a couple of hours before bed. And then there's L-theanine. L-theanine is an amino acid found in tea that promotes relaxation and sleep apnea. And the dose there is usually between 10 and 200. And all these dosages could be smaller for certain people or much larger for others. And then there's chamomile. And of course, that's an herb used to treat insomnia and anxiety for centuries. It helps improve sleep quality, even in sleep apnea. 1 to 2 cups of tea, although I usually prefer not tea because you don't know how much is in there. And it's very, very little, very tiny amounts of these herbs in there. So they're not likely to really help. So the chamomile is also somewhere between 100 and 200 milligrams per day. And then there's 5-HTP. So 5-HTP is a compound that helps increase serotonin in the brain. And that can improve sleep quality because serotonin is a sleep chemical. And one of the reasons why melatonin helps sleep quality is because melatonin helps increase serotonin. And serotonin is a relaxing amino acid. The dose for 5-HTP, somewhere between 500 and 300 milligrams, about an hour or two before bed. Then there's glycine. So glycine is an amino acid that promotes sleepiness and improves sleep quality. It can improve sleep quality in people, again, with sleep apnea. And I keep mentioning that because sleep apnea medically, it's very tough to treat. But there seems to be quite a lot of nutritional promise. And the dose of glycine is usually about 3 grams a day. And then there's cognitive behavioral therapy, or psychological therapy, or CBT. It's a type of therapy that helps individuals identify and change negative thought patterns and behaviors related to their sleep issues and other health issues, mental health issues, and it can help improve sleep quality. So CBT is one of my favorites in terms of psychological techniques. I'm going to throw in one more bonus that you should think about from the natural perspective is the use of something called GABA. GABA is gamma-aminobutyric acid, and it improves sleep by acting as a relaxing or what's called an inhibitory neurotransmitter in the brain. That's what GABA is. And it's used in medicine. It used to be used quite routinely by neurologists because it's great for depression, anxiety, pain, and sleep. And it's super safe. And you can go very high doses with that without having issues usually. So again, don't experiment with this on your own, particularly if you're on any medications, because some of these nutrients may be contraindicated with a variety of medications. And sometimes the nutrients work and help promote the medications to work even better. So I wanted to throw GABA in there, very, very important. So now I'd like to finish off by providing you a handful of lab tests that you might want to ask for or consider when you want to figure out your actual needs in terms of nutrition and its role in sleep. So one is a vitamin C test of the urine. You need to understand that vitamin C plays a crucial role in maintaining health. We all know this. And low levels of vitamin C may be insufficient due to dietary issues, malabsorption, or chronic sleep problems, which have your body use up the vitamin C. Any stress that you have, stressor of lack of sleep or aging or disease or inflammation, pain, you name it, you're gonna burn through your vitamin C levels. And then we won't have enough vitamin C to heal soft tissues and collagen, so we get arthritic changes and breakdown. But a deficiency in this vitamin can lead to sleep disturbances. We know this. For example, there was a study that examined the relationship between vitamin C intake and sleep quality. It was a meta-analysis. That's a systemic review, very, very systematic review of all of the proper vitamin C studies and sleep. And it concluded that higher vitamin C intake is associated with better sleep quality. But if you just pour the vitamin C in you, you might cause other nutritional issues or might get what's called a reverse effect, which means one amount of supplemental vitamin C helps your sleep apnea or your sleep problems, and going higher makes them worse, and going higher still might make them better. So it's important to get tested. And then there's a chemical known as urinary malonyl dialdehyde. And again, don't worry about the names because you can just search my website and you'll find all of these notes, okay? So urinary malonyl dialdehyde, it's a biomarker of inflammation and oxidative stress. And the presence of this in excessive amounts in the urine can and often does negatively impact sleep quality. So oxidative stress occurs when there's an imbalance between the production of these reactive oxygen species, which cause all kinds of damage, and the body's ability to neutralize them. So high levels of urinary malonyl dialdehyde indicate that the body is experiencing increased oxidative stress, which usually results in increased wakefulness, therefore giving us sleep disturbances and poor sleep qualities. And there was a wonderful investigation entitled The Role of Oxidative Stress in what was it? The role of oxidative stress and antioxidant defenses in sleep disorders. And that study investigated the relationship between oxidative stress and sleep disorders, including malonyl-dialdehyde. And there was an association. So we want to get the MDA much, much lower. And how do you do that? By giving a person the right doses and types of antioxidants. And some people, they might need 5 different antioxidants. Another person, maybe just 1. Some people need antioxidants that work well in the watery compartments of the body, like vitamin C. Other people get better sleep and lower malonyl-dialdehyde levels when they have more when they take more of the fat-soluble antioxidants, like vitamin E, for example, which works in the fatty areas, as opposed to the vitamin C, which works in the watery areas. If you want to learn more about oxidative stress, you can just search that on my website as well under the search bar on the home screen. That can clarify that a little bit more for you. And then there's urine calcium. So urine calcium levels can be an indicator of bone health and overall metabolic function. So high urine calcium might suggest an imbalance in the body's calcium metabolism, which can lead to poor sleep quality because calcium is needed for neurologic function in the brain. Most people don't know that. They just think of bone health. But proper calcium intake is essential for maintaining healthy sleep patterns, but your body has to be using that calcium. If you have it spilling out in your urine, there's a problem with use. And there was a study, I think it was entitled The Relationship Between Calcium Intake and Sleep Quality in Older Adults. And that study was very interesting because it examined the relationship between calcium intake and sleep quality in older people, and they found that adequate calcium intake is associated with better sleep quality, and you know, with not just older people, but anyone past age 50 has some level of malabsorption. So the thing to do is to make sure that you're absorbing normally. And the next test is an absorption test, because if you malabsorb, one of the reasons for that might be because the person doesn't have enough stomach acid or digestive enzymes, and they can't activate the calcium in their diets. If the calcium is not activated, it doesn't work correctly. So if you're taking antacids or you're over 50 years old, malabsorption and therefore malnutrition might be the cause of a lot of your health problems, not to mention sleep issues and calcium issues in the urine. So there is an absorption test called indican, and it's measured in the urine as urinary indican, and it's a byproduct indican of tryptophan metabolism. Tryptophan is an amino acid, and tryptophan is a precursor. It forms serotonin and melatonin in the body, both of which play crucial roles in sleep regulation. So if you have a high level of indican in your urine, that might indicate poor tryptophan metabolism, which may lead to sleep disturbances and poor sleep quality. I first became aware of this years ago when I read a study on the role of indican in sleep regulation, and the study investigated the relationship between indican levels and sleep regulation, and they found that high indican levels are in fact associated with poor sleep quality. And sleep specialists do not measure indican. They do not measure urinary calcium. They do not measure urinary malonyl-dialdehyde. They do not measure low urine vitamin C. And in fact, the sleep specialists almost never even look at your laboratory work from other doctors, which might reveal any number of health conditions or diagnoses that are the cause of your problem. They just don't have that information. They should have that information. That is just insane to me to see how disjointed the care is with many sleep specialists. Not all, but many. Most, I would say. Most because I've never heard one over the last 30 years that's actually done thorough laboratory work or even asked to see all the laboratory work that a person might have from other doctors. And then there's a really important one known as pH. pH is a measure of acid-base balance in the body, okay? And we have different acid-base balance in different areas of the body. So let me put it this way. Blood pH is a critical indicator of overall health, which absolutely can impact sleep quality. So, for example, it's very common that I'll find a person has a low blood pH, or what's known as acidosis, which can result from all kinds of problems, including poor diet, infection, various medical conditions. And acidosis can disrupt sleep patterns and lead to poor quality. So you would need to know what your blood pH is. The blood, everyone, is what you want to know. There was a wonderful article titled The Impact of Acid-Base Imbalance on Sleep Quality, and that study very smartly examined the relationship between blood levels, or blood pH, I should say, and sleep quality. And they found that low blood pH levels are associated with poor sleep quality. So how you fix the low blood pH, how you fix the increased urinary indican malabsorption, how you fix the increased urine calcium, how you fix the increased malonyl-dialdehyde, how you fix the low urine vitamin C may depend on a lot of different factors. But again, a nutritional professional who has experience with sleep problems, who has license to order and interpret laboratory work is important. Now, I should give you one more caveat here, is that there are nutritionists in different states that, even though they are not supposed to be reading and ordering laboratory work, are in fact doing that. And many of them, I'm sure, just don't know or understand their scope of practice, which does not allow them to do that for a very simple reason. They're not trained. But you might say, well, how do these labs allow these practitioners to do these tests? Some laboratories will cater to anyone who pays them. So it's actually probably illegal. It certainly is against regulations. But again, you want to make sure the practitioner that you see is qualified to do what you need. An examination, important health questionnaires, a detailed medical intake, and the proper laboratory tests, among other things. So in addition to low pH, which is an issue, there's high blood lactic acid. So high blood lactic acid, or lactic acid acidosis, can result from all kinds of issues: poor circulation, intense physical exercise, and an unlimited number almost of medical conditions. Elevated lactic acid can lead to sleep disturbances and poor quality because it promotes inflammation and it activates the wake centers in the sleep centers in the brain. There's an article you might want to take a look at called "Lactic Acidosis and Its Impact on Sleep Quality." Again, if you don't have anything else good to read, you'll want to read this like I do. But this study was very interesting. It investigated the relationship between lactic acidosis and sleep quality, and they found that high blood lactic acid levels are very strongly associated with poor sleep quality. So you've got to lower those. How do you lower them? Sometimes hyperbaric therapy lowers them. Other times it's the right antioxidants. But the best answer I can give you right now on how to figure out what everyone needs is blood tests specific to your entire health, medical history, and health goals, the appropriate lab tests, and then the trial and error process of trying certain doses of different herbs and vitamins and foods and exercise plans until you get it right. And then there's another one. This is the last one I'll mention in terms of testing, is low blood nitric oxide. So nitric oxide is a signaling molecule that plays a crucial role in regulating blood flow, blood pressure as well, and also sleep. So low blood nitric oxide levels can lead to poor circulation and therefore sleep disturbances. And that was backed up by a wonderful study, the role of nitric oxide in sleep regulation, where in this study they examined the relationship between nitric oxide levels and poor sleep regulation. Think of it this way. Think of a tube like a garden hose, and that's your blood vessel to your brain. And nitric oxide is actually made by the cells that are the garden hose itself, and it causes the garden hose to become bigger and bigger and bigger in terms of diameter. So if it comes bigger and bigger and bigger, it can transport more water, right? That's what a garden hose does. But if you transfer that knowledge to a blood vessel, the very same thing happens. The blood vessel makes nitric oxide, which should vasodilate the blood vessel. But if we have low nitric oxide, then that's low circulation to the brain, oxygen deprivation, nutritional delivery deprivation, therefore the brain wakes up. Okay, well, I hope I didn't put you to sleep with all this talk about insomnia, and that, yes, that was in fact a joke. And I want to thank you all for listening. Once again, you can go to the website at drmichaelwald.com. Let me know your comments, questions, and your wonderful show topic ideas. I've got a whole list of them here I'm going to try to get through in the next couple of months that you all have requested, and I appreciate that very much. And you can call me too at 914-552 1442. I'll see you next time on Ask the Blood Detective. You've been listening to Dr. Michael Wald. Take care, everyone.